Hi, I'm Dr. Buffy with IPCWell, and today I want to talk to you about the new CDC recommendation for implementing enhanced barrier precautions. Now, this has created quite a stir within our long-term care industry, with many nursing homes feeling like it's taking away from their home-like environment, or that it's going to be a significant cost with added gown and gloves. And so I want to dive deeper into why this is so important to implement and then how you can successfully implement this within your facility. I want to first remind you that antimicrobial resistance is an urgent global threat. It's not something that we only face here in the United States. It's across the entire world. And so what does this have to do with enhanced barrier precautions? Well, there's new research that demonstrates that residents in long-term care that are documented with a multi-drug resistant organism may be different than what's actually occurring within your facility. And so let's take a look at the research that dives into this a little bit further. One study by McKennell et al. Demonstrates residents that were actually documented with an MDRO versus when they tested everybody, it showed a whole different story. So you see here, for example, that within the long-term care skilled area, there were 14 residents. And those that were documented, only 17% demonstrated that they had an MDRO. But when they tested everybody, that number jumped to 58%. So this means that these infections are silently spreading within this healthcare setting. Another study that is very interesting comes from the Chicago Department of Public Health, where a nursing home was evaluated for their prevalence of C. auris. And you'll see here that originally only one resident of the 69 actually had a documented case of C. auris. When we look further after everybody was tested, that number jumped to 29 residents. So it went from 1 to 29 residents. So we see the issue with basing our prevention practices merely on the residents that have a documented multi-drug resistant organism. And would you agree that we need to take it a step further? Well, we're not going to test everybody every time they're in our facilities. That's not practical. And so an alternative is to implement this enhanced barrier precautions for residents that are at high risk. So how do we implement this new practice? If you have a resident that is high risk, meaning they have an indwelling device or a wound, an indwelling device can be a catheter, an IV, a PEG tube, a ventilator, and you are performing high contact resident activities such as bathing or dressing, transferring. You can look here at the actual signage that the CDC provides to help you remember when to apply these extra measures. A couple things to keep in mind. We want to make sure that we provide a ton of education to our healthcare workers, especially those certified nursing assistants that are delivering the majority of these high contact activities for the residents. We want to make sure that the gown and gloves are single use. We don't share them. Even if you have two residents in the same room that are both on enhanced barrier precautions, we use PPE as single use. Make sure that you have easy access to that PPE. So I really like suggesting to put it inside of the resident room versus outside of the room, because as you remember, this is different than contact precautions where we're saying we're preventing potential spread of these multi-drug resistant organisms. I also want to mention that it's important to remind the staff that these residents do not have an active infection. If they have an active infection, they will actually be on contact precautions. In order to successfully reduce the risk of spreading multi-drug resistant organisms and to have a successful program, it needs to be multi-layered, to have really good communication with our other healthcare providers. In addition, you want to make sure you're conducting hand hygiene audits, environmental cleaning audits, because if we don't have these basic infection prevention practices in place, then taking the leap to implementing this protocol of enhanced barrier precautions is going to be a challenge. So we want to make sure that we have all of these different layers to have a successful program. I hope that this was helpful to you today and will help you successfully implement these new practices to keep your healthcare environment safer, to decrease the risk of those harms and deaths due to infections within your healthcare setting. I'd love it if you give us a thumbs up, click subscribe, and that notification bell so that you're always aware when we provide more training videos for you. Thanks, and be well.